Welcome to this video presentation on the ethical dilemma of confidentiality and societal clients. My name is Osmara Flores and I'll be your host. As mental health professionals, or if you're interested in becoming one, they often face difficult decisions when working with clients who might be at risk of harming themselves. In this video, we are going to explore the tension between maintaining confidentiality and the duty to protect suicidal clients. So, what is the ethical dilemma? On one hand, we have the principle of confidentiality, which is essential for building trust with our clients. It is a counselor's ethical duty to protect the client's right to privacy. On the other hand, we have the duty to protect our clients from harm, which might require breaching confidentiality. Therapists have a legal duty to protect identified third party who is being threatened and suicidal clients. The principles of autonomy, beneficence, non-maleficence, and justice are all relevant to this dilemma. Autonomy refers to the client's right to make their own decisions. Beneficence refers to our duty to promote the client's well-being. Non-maleficence refers to our duty to do no harm. And justice refers to our duty to treat clients fairly and without discrimination. The issue of confidentiality in societal clients is not new. In fact, it has been debated by mental health professionals and ethicians for centuries. Let's take a look at how different cultures and historical periods have addressed this issue. For example, in ancient Greece, the Hippocratic Oath emphasized the importance of confidentiality in the physician-patient relationship. In contrast, in some indigenous cultures, the concept of confidentiality is not as individualistic, and the community may be involved in decision making about the client's care. As mental health professionals, we have a duty to maintain confidentiality while also protecting our clients from harm. HIPAA plays a critical role in this process. The Health Insurance Portability and Accountability Act is a federal law that was enacted in 1996. The law is designed to protect the privacy and security of patient health information. Mental health professionals, including therapists, counselors, and psychologists, are considered covered entities under HIPAA. This means that they must comply with HIPAA regulations, including maintaining confidentiality. Let's go back to history. In 1976, the California Supreme Court ruled in case of tariff in various regions of the University of California. Presenting Potter, a graduate student at the University of California, Berkeley, had been in therapy with Dr. Lawrence Moore, a psychologist at the university's counseling center. During therapy, Potter revealed his intentions to harm Tatiana Cherov, a woman he had become obsessed with. Dr. Moore believed that Potter was a danger to Cherov and notified the campus police. However, the police did not take any action, and Potter secretly killed Cherov. The Cherov family sued the university and the therapists involved, arguing that they had a duty to protect Tatiana from harm. The court ruled in favor of Cherov family, establishing that mental health professionals have a duty to protect identified third parties from harm. In 1973, the North California Supreme ruled in the case of Bradley versus State. This case involved a patient named Gary Bradley who had been involuntarily committed to a psychiatric hospital after threatening to harm his mother. While in the hospital, Bradley told his psychiatrist, Dr. Thomas L. Johnson, that he intended to harm his mother when he was released. Dr. Johnson did not take any action to harm Bradley's mother or even to protect Bradley's release from the hospital. After Bradley was released, he killed his mother. The court ruled that Dr. Johnson had a duty to protect Bradley's mother from harm, and that his failure to do so constituted a breach of that duty. The Bradley case established that mental health professionals have a duty to protect and identify third parties from harm, even if it means breaching confidentiality. So, what are the possible solutions to this ethical dilemma? One approach is to use a collaborative care model where we work with other healthcare providers to ensure that clients receive comprehensive care. This can help us balance our duty to protect the clients with our duty to respect their confidentiality. The definition of collaborative care model it is informed consent. It is the process by which a client grants permission for a healthcare provider to disclose confidential information to others. The key components are client-centered care, regular communication and coordination, shared responsibility among the team members. Benefits: improve clients' outcomes, enhance safety and risk management, better coordination of care, reduce burden on individual healthcare providers. Let's take a look to this case study. Patient Sarah, a 35-year-old mother of two, presenting issue: depression, anxiety, and suicidal ideation. Collaborative care team: primary case physician, Dr. Smith; licensed therapist, Ms. Johnson; case manager, Ms. Thompson; psychiatrist, Dr. Lee. Interventions: first, Dr. Smith refers Sarah to Ms. Johnson for therapy. Then, Ms. Johnson conducted an assessment and developed a treatment plan. The third step was that Ms. Thompson coordinated care and communicated with the team. The last step was that Dr. Lee provided consultation and guidance as needed. We have learned the value of collaborative care in providing patient outcomes, and also the need of clear communication and coordination among care team members. Another approach is to obtain informed consent and a waiver of confidentiality from the client. This allows us to balance the client's right to confidentiality with our duty to protect them from harm. This is the following definition. Informed consent is the process by which a client grants permission for a healthcare provider to disclose confidential information to others. The key elements are clear explanation of the risks and benefits of disclosure, the client's voluntary agreement to disclose confidential information, specification of the individuals or organizations to whom information will be disclosed. Benefits: allows for disclosure of confidential information to prevent harm to the clients or others. It can also facilitate collaboration between the healthcare and other stakeholders. Let's take a look through the following case study. Client: Emily, a 24-year-old college student, presenting issues suicidal ideation and severe depression. Scenario: Emily's therapist, Dr. Davis, determines that Emily is at high risk of a suitcase and needs immediate hospitalization. However, Emily refused to consent to hospitalization. Consent or waiver: Dr. Davis explained the risks and benefits of hospitalization to Emily and obtains her consent to disclose confidential information to Emily's emergency contact and the hospital staff. This case study illustrates the importance of obtaining informed consent and using a waiver of confidentiality in during where a client poses a risk to themselves or others. In conclusion, the ethical dilemma of confidentiality in suicidal clients is a complex issue that requires careful consideration. By understanding the principles of autonomy, beneficence, non-maleficence, and justice, and by using possible solutions such as informed consent, collaborative care, we can balance our duty to protect our clients with our duty to respect their confidentiality. Thank you so much for listening to this theme about my presentation, The Ethical Dilemma of Confidentiality in Suicidal Clients. These are my references. Thank you.